Bonjour tout le monde.
Hello, everyone.
I want to take a moment to recognize Canadians who are doing some of the toughest jobs in the country. The women and men working in our hospitals, our seniors' homes, and our long-term care facilities are making sacrifices every day. If you do one of these jobs, thank you. Thank you for keeping us safe and healthy and protecting our loved ones. You deserve our full support. So if you need a hand getting through these tough times, we'll be there for you. Today, we're announcing more help for more Canadians. This includes topping up the pay of essential workers. At the same time, we'll also be expanding the Canada Emergency Response Benefit to reach people who are earning some income, as well as for seasonal workers who are facing no jobs, and for those who've run out of EI recently. And a little later, I'll have some news about where we are with testing. Au Parlement, vous m'avez entendu parler des contributions.
In Parliament, you've heard me talk about the contribution of the generation that grew up during the Great Depression and fought during World War II. Today, across the country, the last members of that generation are living in senior care homes, nursing homes, and the truth is extremely disturbing. It is that those very places where we look after our seniors are particularly vulnerable to COVID-19. That is a subject I will be tackling with the premiers during our discussion tomorrow evening. We must all do better. We must all demonstrate leadership to support the seniors who built this country. To begin with, our government will be working with the provinces and territories to increase the pay of essential workers earning less than $2,500 a year, like people in our long-term care homes.
Contributions of the greatest generation, who grew up during the Depression and fought through the Second World War. Today, across the country, the last members of this generation live in nursing homes and long-term care facilities. The uncomfortable and tragic truth is that the very places that care for our elderly are the most vulnerable to COVID-19. I will be addressing this with premiers tomorrow night. We all need to do better. We all need to take leadership for the seniors who've built this country. Our government will work with the provinces and territories to boost wages for essential workers who are making under $2,500 a month, like those in our long-term care facilities. For many workers looking after the most vulnerable Canadians, including seniors and those with disabilities, we know conditions have gotten more difficult over the past weeks, and you need support right now. Tomorrow, in our weekly meeting, I will discuss with provincial and territorial leaders the importance of getting this wage boost in place as quickly as possible. As we face an unprecedented threat to public health, you are our most important line of defense. We will do whatever we can to help you do your job and support you through this time.
In March, our government established the Canadian Emergency Response Benefit, which is part of a plan we put in place to make sure that everyone had the help they needed to get through this difficult period. Millions of people have already received the CERB, but we know that a lot of people who didn't qualify for it still need help. So today we are going to loosen the eligibility criteria so that even more people can take advantage of the benefit, can be provided with a benefit. If you earn up to $1,000 per month, you can still apply for CERB because many people aren't getting the hours they were used to. Workers who have recently exhausted their employment insurance benefits will also qualify for CERB. Across the country, a lot of people will not have seasonal work this year because of the pandemic. They will also be able to apply to the CRB, which will be there for them. Things are also difficult for artists and creative people across the country. Cultural sites are closed. Work is very hard to obtain. Minister Guilbeault heard that artists were asking that a copyright for work completed before the crisis not be included in applications for the CERB. During these difficult times, it is artists who help us continue to dream and who put a bit of sunshine into our daily lives. We appreciate what they do.
We are expanding the Canada Emergency Response Benefit to include people making up to $1,000 a month, seasonal workers, and people whose EI has recently run out. Maybe you're a volunteer firefighter or a contractor who can pick up some shifts, or you have a part-time job in a grocery store. Even if you're still working or if you want to start working again, you probably need help in making ends meet. So if you earn $1,000 or less a month, you'll now be able to apply for the CERB. If you were expecting a seasonal job that isn't coming because of COVID-19, you'll now be able to apply. And if you've run out of EI since January 1st, you can now apply for the CERB as well. And for others who still need help, including post-secondary students and businesses worried about commercial rent, we'll have more to say to you very soon. No matter who you are or where you live, we're in your corner.
After having accepted a first request for assistance by Nunavik, the government of Quebec sent a second request for assistance on the lower North Shore. The Canadian Rangers will be going to lend a hand.
From the Canadian Armed Forces for Nunavik, the government of Quebec has sent us a second request for Basse-Côte-Nord. I can confirm that the Canadian Rangers will be there to provide support. I want to thank our women and men in uniform and the families who serve alongside them for all that they do. Whenever we need you most, you're always there for us. Par moment, on peut se sentir.
Sometimes we could easily feel overwhelmed by what's happening. This situation seems surreal, and it's very difficult to deal with everything that's happening. This week, the government is launching a portal that brings together all kinds of mental health resources that are there for you. You can go to the site canada.ca or use the Canada COVID-19 application to speak to someone. There is no reason to feel ashamed. When you need help, it will be there for you.
And there are people who can help. We have launched a mental health portal at canada.ca and through the Canada COVID-19 app, where you can go to find support. So if you need to, please reach out. We'll be there for each other. Finally, we have more news today to share on testing. Lumen Ultra from New Brunswick, with whom we signed a contract, is now ramping up production to supply enough COVID-19 test chemicals to meet the weekly demand in all provinces. And in the last few days, we received a new batch of swabs to make sure every province has the supplies they need to keep testing. Whether it's reagents or test kits, we are ensuring that Canada has the tools to fight this virus. Tomorrow, I'll also be speaking with the other G7 leaders about continuing to coordinate a strong and effective global response to this pandemic. L'entreprise Lumen Ultra du Nouveau-Brunswick est en train d'augmenter.
The New Brunswick Corporation Lumen Ultra is increasing its production so it can provide sufficient reagents to conduct the number of COVID-19 tests needed each week across the provinces. In the past few days, we've also received more swabs for the provinces. I know that everybody wants to know when life will get back to normal. But the truth is that we can't say. Not specifically, but here's what we do know. If this is to end, we need to stay home. We need to travel as little as possible. We need to keep a physical distance between ourselves and other people who don't live with us. And if we all do our share, we will get through this together. Thank you.
Prime Minister, we'll now go to the phone for questions. There will be one question and one follow-up. Operator.
Thank you. Merci. La première question, Michel Lamarche, TVA Nouvelle, à vous.
Mr. Trudeau, I'd like to hear you on the discussions with Quebec on the Canadian Armed Forces assistance for long-term care homes. Are members of the armed forces ready to be deployed to those long-term care homes? Talks with the provinces are ongoing, Quebec and the provinces, to see where we can help. There is a portal where people with medical experience or other specialized experience can offer their assistance. We have shared the portal with all the provinces. We are continuing to work directly with Quebec on their request for more resources, and we will continue working with Quebec. But you didn't answer the question. We know you're working on this, but Quebec said yesterday we need more people on the ground. In addition to military personnel, can you have the army help with serving meals, picking up waste? What can you do right now? What we're doing right now is speaking with Quebec to see how we can help. We recognize that Quebec has needs, as most parts of the country do, and that's why we're working with the provinces to provide them whenever we can with the resources they need. We're there to be a partner and provide assistance as quickly as possible when it's required and necessary. Next question. Mélanie Marquis, La Presse. Mr. Trudeau. What do you think about Mr. Trump's decision to suspend funding to the WHO?
De faire tout ce qu'on peut pour protéger les Canadiens, pour assurer la santé et la sécurité des gens à travers le pays. Et ça implique travailler avec les experts ici au Canada et à travers le monde. Et on va continuer de faire ce travail important pour les Canadiens. Okay. One of the things that is so important for Canada to do is to continue to work with local experts and international experts to do everything we can to fight this virus and keep Canadians safe and protected. That's what we will continue to do.
Je veux bien, mais
Don't you fear consequences for the worldwide struggle against the pandemic? Well, tomorrow we'll have a chance to have a discussion with the other G7 leaders for the purpose of having the best possible coordination in order to check COVID-19 and also to have science-based efforts and based on the advice coming from experts, worldwide experts.
Thank you. Merci. The next question, Justin Ling, freelance. Please go ahead.
Hi there, Prime Minister. Obviously, I've been asking you for about a month now about the state of Canada's prisons. You've promised repeatedly that new measures would be coming, that the Minister of Public Safety would be announcing new cooperation with the parole board. We still haven't seen any of that. So is this just not a priority? Is nothing coming? Is there even going to be a decision about those inmates who are being released on day passes, like other provinces have done, to release them temporarily? Is there any announcement coming?
We have made significant efforts and taken significant steps to ensure that our incarcerated population is kept as safe as possible from COVID-19. There are a number of measures that we've taken. We continue to look at more measures. We're coordinating with the provinces on these efforts as well. We know that this is an area where we've seen challenges in terms of outbreaks, but we also are continuing to step up our efforts every day to ensure that all Canadians are protected.
So you're stepping up your efforts. The directive from the commissioner last week said that corrections officers should wear face masks. The Corrections Canada has previously said they're providing soap and hand sanitizer. By all accounts, those things aren't happening. So if the work you're doing isn't happening, do you need to change tack? And finally, have you totally abandoned the idea of releasing federal inmates?
There have been a number of discussions at the highest levels about various processes that need to be put in place. There have been a reduction in transfers, in issues that have put potentially people who work there and people who are incarcerated there more at risk. We have taken a number of measures. We will continue to look at taking more measures, and we will ensure that the measures in place are properly followed. Okay. We
recognize the importance of protecting people who work in our federal institutions and as well as the inmates. So we will continue to make sure that these measures are implemented, and we will be looking for new innovative ways of guaranteeing the people's security.
Canadian Press, please go ahead.
Good morning, Prime Minister. Social distancing advice differs from jurisdiction to jurisdiction, from Vancouver closing Stanley Park to cars, so more people can walk around it, to Ottawa's local experts telling people to basically not chat on their driveway with neighbors. In light of this, how do you sustain public confidence in social distancing measures?
I think we've been very, very clear that the best way to prevent further spread of COVID-19 is to stay home as much as possible. If you have to go out infrequently and keep 2 meters distance from each other and wash your hands aggressively and often. These are the things that we're asking all Canadians to do. Across the country, we recognize that different communities are in different situations, that there are different local health experts giving advice that is suitable to that particular context. We make sure that everyone is getting the message that we all have to do our part to fight COVID-19, and that means engaging in social distancing, but it is perfectly normal that there be slight variances in approaches in a pandemic that is manifesting itself in very different ways in different parts of the country. Okay. Nous soulignons à quel point c'est important.
We want to emphasize how important it is to take measures for the purpose of preventing this further spreading of COVID-19. So let's not go out of our homes unless it is absolutely necessary. And if we do so, let's keep our physical and social distancing, and let's wash our hands often and very, very thoroughly. Obviously, the situation isn't the same from one region of the country to another, so local experts will give varying directives to the local population, but the main purpose is to keep our implementing a social distancing and also check the spread of COVID-19. S'agissant de l'Organisation mondiale de la santé, alors, quel est l'appui financier qu'apporte le Canada à l'OMS? Est-ce que le président américain a essayé de faire pression sur le Canada pour qu'on suive l'exemple des États-Unis? L'appui du Canada pour l'OMS se compte en dizaines de millions de dollars et nous l'avons récemment augmenté. Je vais vérifier les chiffres et nous pourrons vous les fournir. et les fournir aux médias en général. Et le président, pour répondre à votre question, n'a pas essayé de faire pression directe ou indirecte sur le Canada. I believe that we provide tens of millions of dollars to the WHO, and we have recently increased our contribution relative to this pandemic, but I will make sure that the exact figure is provided to you within the next hours. And the answer is no, there was no pressure exerted by the U.S. President on Canada regarding the WHO.
Glenn McGregor, CTV News. Prime Minister, you've repeatedly said how much Canada has relied on WHO for information about what's happening around the world. Are you satisfied the organization sufficiently interrogated the information coming out of China in the early days of the pandemic? We know now a lot of the information was either false or misleading, especially about human-to-human transmission. Do you think they did a good job on how they handled that information and shared it with other countries?
I think what we need to remember is the path through this pandemic is for us to base ourselves on science, on the recommendations of experts, on the data and the knowledge that we've gathered from past pandemics and past health issues to apply to these situations. And that's why we will always continue to work with experts, both domestically and internationally, to take the best advice possible in keeping Canadians safe. Of course, in the coming months and years, there will be many reflections on various institutions and systems, both domestically and internationally, on how we can improve our response, how we can learn from things we could have done better in this process. These are things that will come in the coming times. Right now, our focus needs to be on doing the best we can right now to protect Canadians.
We're hearing about potential shortages of medication used for pain-killing and sedation before patients are intubated and put on ventilators. What's happening at the federal level to ensure that there's a continued supply of those medications?
Public Health Canada and Procurement Canada are working together to ensure the steady supply of essential medications to Canada, both related to COVID-19 and not. We recognize that this is a global health crisis, so there are challenges, but Canada has a very strong pharmaceutical industry. We have very strong relationships around the world on getting medication and necessary supplies, and we will continue to do everything we can to ensure that Canadians get what they need. Nous avons nos équipes et nos ministères en train de travailler avec.
Our teams and our departments do cooperate with our provincial partners, our partners throughout the world, for the purpose of guaranteeing the supply of all the materials and items that we need for the purpose of fighting COVID-19. And we'll keep doing whatever we can for the purpose of securing the supply of those items for Canada. And Canada should always have the necessary equipment and items.
On that WHO, you were just asked this, but the Conservatives and others have raised concerns that the WHO was too willing to take the word of the Chinese regime early on in the pandemic. Do you share those concerns?
I think there's obviously reflections that we have to have going forward, and we have to make sure that we are doing everything we can to keep Canadians safe. And that is our focus right now. What can we do now? What do we need to do in the coming weeks? How do we lean on experts in international institutions and in partner countries around the world who are making recommendations alongside our domestic experts on what we need to do now? There will be plenty of time as we move forward to reflect on challenges that were faced in the past. We need to learn and move forward as quickly as we can.
And you said yesterday that you're talking to the provinces and territories about eventually reopening the economy. Can you say what work specifically you're doing with the provinces and territories to do this? And you also said that there are different points along the spectrum of the pandemic. So do you see when things do start returning to normal, is that going to be on a provincial level, a local level, a national level? How's it going to work?
Well, we recognize that this pandemic is going through very different phases at different points, different places across the country. One size fits all will not work for a country as diverse as Canada, but the overarching principles are extremely important. We know, regardless of where you are in the country, we need to get through this first wave before we can start releasing some of the rules around social distancing and staying at home. How that release works will vary from region to region, from industry to industry, and coordination at the federal level on how we do that is going to be very important. But with spring coming, people are looking outside, wanting to get out, wanting this to be over. I understand that. It will be weeks more before we can seriously consider loosening the restrictions. It would be terrible if we were to release restrictions too early and find out that we're suddenly back in another big wave of COVID-19 and everything we've gone through up to now would have been for nothing, because we'll find ourselves once again in the same situation. If we hold on through this period now, as long as we have to, once we are able to release things, we will be able to better control how things move forward. But as impatient as people are getting all across the country, we need to continue to hold on if what we're doing now as sacrifices are going to be worth it. Okay. Je reconnais à quel point les gens veulent savoir.
I do recognize how impatient people are getting and want to know when we'll be able to soften the rules in terms of social distancing and also help the recovery of our economy. However, if we lower our guard too early, we might be confronted with another wave which would have even more terrible, even more devastating consequences. So people are now sacrificing, they're now accepting measures which are difficult to implement. Well, let me tell you, this will be on for another number of weeks if we want to be able to correctly manage the situation and have a gradual exit from the crisis. Of course, we'll have to coordinate with the provinces, but mostly we'll have to try and remain within this phase and its constraints in order to make sure that when we release the constraints, we will not find ourselves starting from scratch with COVID-19 attacking us.
But just to follow up on that, I'm wondering whether you envision when that happens that workers will be tested before they return to work.
Obviously, when we are able to loosen the controls on social distancing and start to reopen our economy, massive, rapid testing on a very wide-scale basis will be an essential part of the vigilance we have to have. There will also be a need for very aggressive contact tracing whenever there is a case that appears. We are going to have to be extremely quick about responding to any future outbreaks in future waves. But in order to get to that point, we need to continue doing what we are doing now for many more weeks. We cannot be in a rush to get things going again, because if we move too quickly to loosen all these controls, everything we're doing now might have been for nothing. We'll find ourselves in another peak just as bad as this one or worse, and it will be extremely damaging both to how Canadians feel, but also to our economy. That's why we are going to be extremely careful about any steps towards reopening the economy. It seems like over the past days, people are talking about, oh, when we reopen this, we'll do this, we'll reopen that. It's not happening yet. If we reopen too soon, everything we're doing now might be for nothing. We are making sacrifices. We're there for each other. We need to hold on still. And then, once we're ready, once we feel we're through, once the experts are telling us that we can talk about reopening the economy a little bit, we will take very careful steps and do that. Okay. Je reconnais que depuis plusieurs jours.
Yes, I do recognize that for the last few days, many people have been talking about reopening the economy. They've been talking about economic recovery and resuming their activities. Of course, this is springtime and people want to go out, and they are very impatient. But we are far from this, let me tell you. Because should we reopen prematurely our activities, we might find ourselves in a situation much worse than the one we've been through, and we would be canceling all the efforts and all the results of all the efforts that we have been accepting. So we do not want this to occur, and so let's continue implementing this wonderful, resilient discipline that we Canadians are demonstrating, and let's do all we can, to protect our seniors, our vulnerable people. So let's keep doing it.
Across the country, with regards to long-term care facilities, people getting sick, people being abandoned, many dying. If your mom was in one of these facilities, what would you do?
I can't imagine what so many Canadians are going through right now with loved ones who are suffering, people they can't even visit right now, seniors worried about falling ill and not being able to see their kids and grandkids again. These are the things that we need to focus on as a country. That is what I will be speaking with premiers about tomorrow night, how the federal government can support the premiers in their responsibility in their jurisdiction over long-term care facilities and senior care, to make sure that we are supporting the heroes who are working in extraordinarily difficult situations for very low pay, to continue that work safely and mostly to keep our elders safe. This is a situation where, as a society, as a country, we need to pull together to be there for our elders who built this country. That's what we're going to focus on in the coming days. Nous reconnaissons à quel point c'est essentiel.
We do recognize and acknowledge how essential it is to do our best for our seniors, and also in order to help the people who heroically work in those long-term homes with very, very low salaries. This is why tomorrow I'll be talking to my provincial counterparts for the purpose of guaranteeing the security and the health of our elders and the people who work and help them. At the moment, they've been confronted with uncertainty, anxiety, fear. They would like to see their children and grandchildren, so we do much better for them. Regarding the long-term care homes, the Canadian Armed Forces might possibly intervene. So will you be sending only medical military staff, or will you send other specialties of our armed forces for the purpose of helping the people and the staff, which is overwhelmed and underpaid? Well, we're doing our best for the purpose of determining how we can send more resources, and we had two specific requests from Quebec in order to send the armed forces to Nunavut and to the Basse-Côte-Nord. So we will continue working with the province, and we will continue to meet their requests in every possible field of endeavor as they see fit.
There have been two requests so far by Quebec to send in support from the Canadian Armed Forces in both Nunavut, in northern Quebec, and in Basse-Côte-Nord. These are things that we are doing. As any more requests come in, we will look to support Quebec or other provinces who are asking for help from the federal government, regardless of what that help looks like and what they're asking us. We will be there to help out as provinces need help.
Sur la pandémie comme telle, vous dites...
Regarding the pandemic as such, you say we have to continue implementing the necessary directives for the purpose of stopping the pandemic. But there will be no stopping of the pandemic for the next few months at least, because there's no vaccine. So do you have at least some draft plans for the purpose of protecting some people, as some other countries do? Answer. Our main concern would be to have our health services overwhelmed by the situation, and we might then move from 2 to 3% mortality rate to much more. And this is what we're setting up. We're setting up various approaches based on technology, based on screening, and based on tracking contacts. So we are at the moment developing and improving the tools we need for that purpose. And once we have been through the first wave of COVID-19, we might be able to perhaps slightly loosen controls on the economy and on our population. But as long as we do not have vaccines, we will still have to remain extremely vigilant, and we will have to react quickly should there be a new wave of COVID-19. And so we are developing those plans. In the meantime, let me repeat that we will have to continue implementing severely and stringently all the restrictions which have been put into place for the purpose of slowing down the spread and look at the future and the next steps.
We know that until there is a vaccine for COVID-19, we are going to have to remain extremely vigilant as a world, as a country, to resurgences, even once this first wave is through. Once we see this first wave pass through Canada without having overwhelmed our healthcare system and our healthcare workers, as we certainly hope, we will be able to look very carefully at how, with extraordinary vigilance and very rapid response times to any future resurgences of the virus, we can carefully re-engage in certain sectors of our economy in loosening up the restrictions. But we are not there yet. We have to be through this first wave sufficiently to be able to know that we have the capacity to stamp out and restrict any future outbreaks as they come along. That means technology, that means better testing capacities, that means continued vigilance, not just by governments, but by all Canadians to preventing it. We're still a number of weeks away from that, but we are reflecting on what that looks like and what sort of technology and medical solutions will be necessary. We will get through this together, but for now, we need to stay strong in our social distancing measures and by staying at home. Merci beaucoup tout le monde.